Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 10 homeopathic remedies for nosebleed. What are nosebleeds? A nosebleed is a loss of blood from the tissue of nose. It may occur from one or both nostrils. Blood may come out from anterior nares or posterior nares. It generally happens suddenly. Generally, it looks graver than actually it is. It looks graver, mind it, it looks graver than actually it is. What are the reasons of nosebleed? Two most common reasons of nosebleed are: number one, dryness of nasal mucosa. Number two, nose pricking. In both cases, nasal lining breaks out and vascular structure beneath ruptures to cause bleeding. Other causes are injury, sticking of foreign substances, allergy, sinusitis, drugs like aspirin, cocaine, etc., atherosclerosis, high blood pressure, blood clotting and vessels disease, nasal polyp, malignant or ordinary tumor, hereditary disorder, pregnancy, high altitude, deviated nasal septum. How to manage nosebleeds at home? Number one, reassure the subject. Since sight of blood makes everybody scary, ask her to stay calm. Make her sit erect with head tilted slightly downward, as shown in this is the subject who is suffering from nosebleed. His head is slightly tilted forward. Forward, downward. Number two, pinch her nostrils just below the nasal bridge. This is the picture. Pinch her nostril just below the nasal bridge firmly with thumb and index finger for 8 to 10 minutes. Ask her to breathe gently. If meanwhile breathing stops, ask the subject to remain absolute calm and quiet for at least next 1 to 2 hours. She may be given warm sweetened milk to sip. And lastly, if bleeding does not stop, immediately call in a doctor. Now below, the nose and the nasal cavity structures have been shown in an image. This is the frontal sinus, this is external nares, this is nasal concas and nasal structure within the nasal cavity. Then here is the posterior nares, nasopharynx. This is posterior nares, this is nasopharynx. That is, here it is connected to the throat. This connected to the throat here on, and these are sphenoid sinus, and these are concas. These are concas. This one lower concha, middle concha, superior concha, etc. In case of nosebleeds, when to see a doctor? See a doctor if, number one, bleeding does not stop within 10 to 15 minutes. Number two, because of bleeding is a severe injury or fall. The cause of bleeding is a severe injury or fall. The subject is 2 years old or less. The subject has been taking blood thinner. The subject uses to suffer from nosebleeds periodically. The subject suffers from hereditary disorder like hereditary hemorrhage, telangiectasia or hemophilia, etc. How to prevent nosebleed? Keep nails of young ones trimmed regularly. Ask them to avoid pricking of nose. Put some Vaseline, etc. in their nostril very often, or use humidifier at night in bedroom. Ask them to keep mouth open during sneezing. Avoid smoking. Agaricus muscarius for nosebleeds. Nosebleed of old persons. Passive type bleeding occurs generally early in the morning, just after rising from bed, while clearing nose with blowing. A few drops of blood comes out, then suddenly copious blood nosebleed occurs relentlessly. There are often profuse fetid nasal discharge, sometimes nosebleed from overwork at desk. Carbophage for nosebleed. Especially in the morning or forenoon or when pressing at stool, frequent continuous nosebleed with distinct paleness of face during and after bleeding, sometimes fainting before. Blood black, thin in an old weak persons, excited by motions or jarring. Words after debauch, Naxbom also maybe here, to be followed by pain in chest, craves fanning over face for a short distance. This is a very keynote symptom of Carbophage. Carbophage patients always wants fanning on over his face from a short distance. Creosotum for nosebleed. Nosebleed of bright red, thin blood from both nostrils in the morning. Sometimes nosebleed may be black, thick blood with foul odor from nose. Children would not sleep unless caressed or fondled. Adapted to problems of post-climacteric women or overgrown, poorly developed children. Words fail during 6 p.m. to 6 a.m. That is night. During night, 6 p.m. to 6 a.m. Lycopodium clavitum for nosebleed. Profuse nosebleed followed by frequent flowing of blood from nose. Discharge of clotted blood from nose. Subjects hunger met up with a few mouthful. Crave sweets, pastries, delicacies. Stomach pain better from hot drinks. Like to take drinks and foods hot. Generally, the underlying symptoms are general symptoms. That is symptom of the person as a whole, and the other symptoms are the symptom of the disease. Ipecacuanha for nosebleed. Most harassing itching in nostrils. Copious bright red nosebleed preceded by nausea and sneezing in continuous or intermittent fevers during whooping cough. Subjects with pale, bloated face, blue margin around eyes. Subject usually suffer from nausea and shortness of breath and sudden fainting. Carbo anomalies for nosebleed. Nosebleed every morning, preceded by headache, vertigo followed by nosebleed, adapted to old persons of feeble constitution or persons whose vitality becomes low due to some serious deep-seated disease or loss of vital fluids. Passadilla nigricans for nosebleeds. Nosebleed from suppressed menses. Blood partly fluid, partly clotted. Words entering a warm room. Symptoms develop very slowly, insidiously, progressively. Subjects inclined to cheat and deceive and feign sickness. This is a mental peculiarity of Passadilla patients. Arsenicum album for nosebleeds. Nosebleed after a fit of passion, passive hemorrhage accompanied by vomiting, great distress and restlessness with anxiety. Patient mentally, physically restless, feel worse at 2 p.m. and 2 a.m. That is, and just after midnight and just after midday. From cold foods and drinks, better from warm food drinks, from walking about, from warm wraps, despair of recovery and fear of death. Silicea for nosebleed. Copious nosebleed. Drops of blood fall from nose when stooped. Bleeding by peeking nose inside during dinner, or profuse dark red blood flows out from bright nostrils with relief of headache. Subjects very much chilly, limp, ice cold, like to wear warm clothes even in summer. In summer, wearing warm clothes. Characteristic of silicea. Cold wind intolerable, want of physical mental grit, small wounds become pulsy easily, these generalities, skin like wax, pale and easy ulceration. Cornea maculatum for nosebleeds. Nosebleeds with suppressed menses from taking cold tends to prick nose constantly. Frequent sneezing, polyps in the nose, arteriosclerosis. Adapted to old person or persons who became old early or with cancerous diathesis used to go to faint during stool, suffering from periodical insanity.